What if something silent and dangerous was growing inside you, and you didn't even know it? This isn't just a hypothetical question. It's a reality for many men facing prostate cancer, one of the most common tumors in men. The scariest part? It often develops silently, sometimes for years, without showing obvious signs. But here's the good news. Knowledge can save lives. Stick with us, because every detail could mean the difference between catching it early or letting it progress unchecked. Prostate cancer is among the most diagnosed cancers in men worldwide, yet so many avoid prevention, held back by fear, shame, or simply a lack of information. But here's the truth. When caught early, the odds of successful treatment skyrocket. Think less invasive treatments, higher chances of a full cure, and reclaiming control over your health. Ignoring it, however, comes with risks. The cancer can spread to bones and other organs, leading to severe complications. That's why paying attention to even the smallest signs can act as a powerful alarm for early action. Here's the challenge. Prostate cancer doesn't always scream for attention. Medical experts warn that it often lacks strong symptoms in its early stages. However, there are subtle clues, small but critical signs, that can point to a problem. Recognizing them and getting tested early can be the difference between a simple treatment and something far more complex. Let's talk about one of those early clues. Difficulty starting to urinate. It might seem like nothing, but it could be your body's way of signaling that something isn't quite right. Have you ever felt the urge to go, but nothing seems to happen right away? You're standing there, ready, but the flow takes its time, or even requires more effort than it used to. This could be one of the first subtle signs of prostate changes. Yes, similar symptoms can come from conditions like benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate, but assuming it's just that, without proper tests, could be risky. Second sign, a weak or interrupted urinary flow. Let's say you finally managed to start urinating, but now the stream seems weaker. Or worse, it stops midstream, forcing you to strain and restart. This isn't just frustrating, it's a red flag. What's causing it? It could be a partial blockage or narrowing of the urethra. While benign hyperplasia might cause similar symptoms, cancer-related growths can have irregular contours that disrupt the flow more significantly. Doctors often describe this as a subtle but important warning sign, yet it's one that too many men dismiss as just part of aging. And yes, it's true. Many men over 50 experience changes in their prostate. But here's the crucial part. Not every change is harmless. Brushing it off could mean overlooking a sign of something much more serious. Your health deserves better. Third sign, increased frequency of urination. Have you noticed yourself waking up multiple times at night just to use the bathroom? Or maybe you feel a sudden urgent need to urinate, even when you haven't been drinking much fluid. If this sounds familiar, it's more than just a nighttime annoyance. It could be a sign of prostate changes, including the possibility of a tumor. Here's what might be happening. An enlarged prostate can partially block the urethra, preventing the bladder from fully emptying. This leaves you with a constant, frustrating sensation of fullness, even right after you've gone. While this symptom is often associated with BPH, only clinical tests can rule out cancer. And let's be clear, this is not something to put off. Increased frequency, especially when it disrupts your sleep, is a signal that your body needs attention. Don't ignore it. Early detection could save your life. Fourth sign, pain or burning during urination. Does urinating feel uncomfortable, painful, or like it's burning? While it's easy to assume this might be a urinary tract infection, UTI, something many men might have heard of, it's important to know that prostate issues, including cancer, can cause similar discomfort. In these cases, the pain can come from tissue compression, local inflammation, or irritation of the urinary tract. Many men mistake this burning sensation as a sign of something minor, like simple cystitis, and delay seeking help. But the reality is that this pain could be your body's way of warning you about something more serious. Does the discomfort keep coming back, or does it refuse to go away? If you're experiencing persistent or recurring pain during urination, it's your body sending you a clear signal. Don't ignore this. It's a warning sign that deserves immediate attention. In cases like these, healthcare professionals may turn to laboratory tests and imaging studies to pinpoint the cause. Whether it's inflammation or something more serious like a tumor, the sooner the issue is investigated, the quicker the root problem can be addressed. Early action leads to better outcomes. Fifth sign, Blood in the urine. Have you ever noticed blood in your urine? It's a sight that can stop you in your tracks, and for good reason. While it doesn't always mean cancer, this condition, known as hematuria, can be linked to prostate tumors. Here's the tricky part. In the early stages of prostate cancer, the bleeding may be so minor that you won't even see it. It might only show up in routine tests, completely invisible to the naked eye. But when blood becomes visible, it could signal something more advanced. Of course, blood in the urine isn't exclusive to cancer. It could also be a sign of infections, kidney issues, or other medical conditions. But no matter the cause, this is not a symptom to brush off. It's your body's way of saying, pay attention. Should I really worry if the bleeding stops after a day or two? Absolutely, yes. Even if the bleeding seems to disappear, it's crucial not to underestimate this symptom. Your body might just be giving you a small glimpse of a bigger issue. Blood in the urine could also result from kidney stones, bladder injuries, or infections. But here's the truth. Fear without diagnosis solves nothing. Instead, take charge by seeking professional help. A comprehensive investigation, including urinalysis, ultrasounds, and, if necessary, MRI or CT scans, can uncover the real cause. Remember, early answers lead to better solutions. These changes manifest in different ways. Some men might experience urinary changes, while others could face chronic pain or fatigue. The key to early detection is noticing any irregularities, no matter how small. Even subtle signs can be the first indication that something's not quite right. Now let's talk about prevention. It's absolutely vital in the fight against prostate cancer. Early detection can save lives, and there are two key exams that should be part of every man's health routine. Are you getting these checked regularly? First, PSA, prostate-specific antigen testing. This simple blood test measures the concentration of a protein produced by the prostate. Elevated levels can signal issues ranging from inflammation to benign prostatic hyperplasia, BPH, or even cancer. It's a warning sign, not a diagnosis, but it's a starting point for further evaluation. Second, the digital rectal exam. I know, it can make some men nervous, but hear me out. It's quick, nearly painless, and crucial for prostate health. This exam allows doctors to evaluate the size and consistency of the prostate. In some cases, this is the only test that can detect irregularities or nodules that could indicate cancer. When combined, these two exams offer a clearer picture of your prostate health. If the PSA test signals a concern, the next step is usually the DRE, which could lead to further tests if necessary. Remember, PSA testing alone doesn't confirm prostate cancer, but it raises the alarm, prompting necessary action. Doctors typically consider the absolute PSA level, but also the rate of increase over time, because the faster it rises, the more urgent the need for attention. Taking action early is the smartest choice. Don't wait for a diagnosis to hit you like a brick. Be proactive. Nutrition, the prevention powerhouse. Your diet is more than fuel. It's a tool for prevention. The foundation of a prostate-friendly diet is simple. Focus on natural whole foods that nourish your body. Here's a cheat sheet to get started. Tomatoes, rich in lycopene, they're a top contender for protecting prostate cells. Green vegetables, spinach, broccoli, and kale are packed with antioxidants and vitamins. Fatty fish, omega-3 in salmon, sardines, and mackerel fight inflammation. Nuts and seeds, think almonds, walnuts, or flax seeds for heart-healthy fats. It's easy to feel overwhelmed when it comes to cancer prevention. But the truth is, small, consistent actions can have a huge impact. Your health isn't just in the hands of fate. It's in the choices you make every single day. If you have a family history, are part of a higher risk group, or notice any unusual symptoms, don't hesitate. Regular checkups and screenings could save your life. Prevention is about empowerment. It's about valuing yourself enough to stay proactive. Prostate cancer prevention is a lifelong investment. Think of your diet as a shield. By fueling your body with the right nutrients, you're empowering it to defend itself against malignant changes. Doctors and nutritionists advocate for these changes not as a temporary diet, but as part of a lifestyle, one that sets you up for a longer, healthier life, facing treatment with strength. If prostate cancer is diagnosed, don't panic. Modern medicine offers a range of treatments tailored to your unique situation. The options depend on factors like the tumor's stage, your age, and your overall health. Let's break it down. Surgery. In cases where the tumor is confined to the prostate, Partial or total prostate removal might be recommended. Radiation therapy. This approach effectively targets and destroys malignant cells, offering hope and relief. Hormonal therapy. By reducing testosterone levels, a hormone that fuels prostate cell growth, can slow down or even halt tumor progression. Active surveillance. For tumors that are less aggressive and grow slowly, doctors might suggest regular monitoring rather than immediate treatment. This approach balances caution with quality of life. Encouraging a culture of prevention is key. We need to embrace this culture fully, including overcoming the stigma surrounding the digital rectal exam. Addressing this topic with the same openness as we would any other illness is crucial for promoting awareness and action. Men who schedule annual or semi-annual checkups are taking a proactive approach to monitor their health closely and address any suspicious issues promptly. This approach can truly save lives. Prostate cancer can develop quietly, but it often gives off warning signs that should never be ignored. Symptoms such as difficulty urinating, weak urine flow, increased urinary frequency, a burning sensation while urinating, presence of blood in the urine, pelvic or back pain, changes in ejaculation, and unexplained fatigue. This isn't about inducing panic, it's about fostering awareness. Any persistent change in your body should never be ignored. It's about taking control and understanding that every year, thousands of men are diagnosed and successfully treated for prostate cancer because they recognized symptoms early and sought help. But sadly, others discover the tumor too late, facing the harsh reality of more aggressive treatments and a higher risk of complications. Value your health. It's the foundation of everything you do. Embrace preventive exams and make them a regular part of your routine. Adjust your dietary habits to support your health and never underestimate any discomfort, no matter how small it may seem. Prevention and early diagnosis are still the most reliable keys to protecting your quality of life and ensuring that you can continue to live life on your own terms. Remember, your health is your most valuable asset. Treat it with the care and attention it deserves. Thank you for watching.